My name is Johnny Pinto Margote in Student University Católica Santiago de Guayaquil in Career Note. Topic Exposition Reservoir of TGA when dries profibrosis stays impacted with pulmonary fibrosis. Definition. Pulmonary fibrosis is characterized by injuries and loss epithelial cells, a normal accumulation of microblasts exhibiting deposition of cocci and other extracellular matrix. ACM element resulting in a progressive of pulmonary function. The role of TGA B1 in the development of lung fibrosis was first recognized 20-year-old in the one of the most potent inducers of NCM production, including collagen and other matrix protein. TGF-B1 expression is elevated in both animal model of lung fibrosis and in fibrosis humana lung. Application in nurse. An application in number one, maintenance of airway parenthesis. Number two, evolution of the characteristics of the bird. Number three, observation is respiratory rating index of brain. Number four, examining the appearances of polypnea, nasal flaring, and uses of accessory muscle for breathing. Number five, whenever necessary, respiration of secretion should be performed. Number six, properly uses inhalation system such as presuses cartridge, nebulizer, drip power inhalator, inhalation chamber, number seven, ensure correct flux intact. Look.
I'm an IPF patient. When I was first diagnosed, people described it as an IPF sufferer. I don't see it as IPF sufferer. I'm impacted by IPF, but I'm an IPF patient.
It was when we got home, or when I got home from work, that it sort of really hit you that, yeah, that's what it was. It wasn't the easiest thing to be told.
After I started to explain it to people, two things happened. One, I walked straight into the stigma about, so you're a smoker then, which I thought's interesting. What's cause got to do with it when somebody already has the disease, and a bit of empathy wouldn't go astray. And secondly, if you met somebody for coffee and told them you had idiopathic pulmonary fibrosis, by the time you explained it was lunchtime, and they were still no closer to understanding what you have.
In terms of how common IPF is, we see around 12 new cases every 100,000 population per year. So for a city the size of Brisbane, we're looking at around 200 to 250 new cases every year. So it's actually quite common, and a lot more common than people appreciate.
You've got a disease group, as I said, kills nearly 20,000 Australians a year. And there's this stigma, but the stigma is purely because the community have no awareness or understanding of what lung disease is. When you tell them you have a lung disease and they simply say, so you're a smoker then.
IPF is a disease that we see typically in people in their 60s and 70s, but it can affect a range of ages. We've seen patients in their late 20s. It is a disease that can affect anyone at any stage in their life. It can have no relationship to lifestyle at all. It can affect a full spectrum of people.
One of the difficult things early on when you first diagnose, what you look at whilst you think about the impact on our lives, and the fact that we may not have the time that we had to do the things together that we thought we did. It's little things with the kids that drive it home. And I can remember one night we took Henry to an AFL game at the Gabba, and I said something like, one of these days you'll be doing that, Henry. And then I thought, yeah, but I probably won't be here to watch that. And it becomes a bit of a driver. My question to them is always, as I've said before, is what's important to you? And what's important to me is watching grandkids grow up and my kids, and having time for Leslie and I to go and do some of the things we plan to do.
Family's very important, and if we can watch the grandkids grow up, then yes, that would be about all we need.
I see the challenge of awareness and community understanding as a challenge and something to be won. I don't accept that we can't win that battle. And in the meantime, I don't believe I can't win this one either. And I'll fight this week by week and year by year, just to prove I can. And one of us will. But it's watching the grandkids and seeing them and your kids and those things around you that are important.
Research is very important in IPF. The treatments that we have available are not cures. They slow the fibrosis, but they don't reverse the fibrosis. So we still need to really promote research in Australia and around the world to find drugs that actually stop the fibrosis or even reverse the scarring of the lung.
I'm just trying to get the conversation, and the more people I can get to, and perhaps leave a lasting impression, if that's possible. If we can just get 10% of them to go away and talk about lung disease in a different light, then we'll start to change the world.
Pros and cons. In the patent with intestinal lung disease, ECG treatment was associated with a reproduction in the phylogenesis and improving equiposis for the performance of the long-term repositioning clinical trial of ACGC involution patent with the condition is one from this is among of two fibroblasts derived sesum bimoker cartigalo oligomeri matriprotein and perisontein associated with IPF activity and prognosis and fluid taxicontin with an antibiotics effects. The multiple assign roles of transforming growth factor beta 1 limit the deployment of global single inhalation of the therapy agent. Using applying in Ecuador. Uniformity in Ecuador no existing are correct regarding demonstration of the FPA pathogenesis in ignore. Atron is the possibly due to the effects of the various factors such as genetic predisposition, environmental to metal dust such as silica and lead, relative work activity with liberty and agriculture as well as family history. Look at the video.
There are many myths and misconceptions surrounding pulmonary fibrosis. The Pulmonary Fibrosis Foundation is your trusted resource for facts about the disease. You may have heard that there are no effective treatments for pulmonary fibrosis. While it is true that there is no known cure for pulmonary fibrosis, there are a number of effective treatments. Supportive care treatments, such as supplemental oxygen, medication, and pulmonary rehabilitation, can lessen symptoms of cough, shortness of breath, or fatigue. Lung transplantation is a treatment option for advanced pulmonary fibrosis and is considered on a case-by-case basis. For some types of pulmonary fibrosis, there are medications called antifibrotics that can slow down disease progression by about 50% on average. In cases of inflammatory or autoimmune pulmonary fibrosis, medications that decrease inflammation or suppress the immune system can be used and may be helpful in some patients. Visit our website to learn more.
In conclusion, pulmonary fibrosis is defined by the of many intestinal lung disease, including doses-induced B autoimmune disease, especially to organic and inorganic and reduction of chemotherapy and avoid the causes of one of the most common form of pulmonary fibrosis condition, idiopathic pulmonary fibrosis, is still not clear. The pathogenesis of EPF import with a median survival of 3 years after diagnosis and currently there are no effective medicine therapy. Thank you very much for your attention.